Good evening, everyone. Thank you all for joining us on day 5 of Conclave in what is one of our last few sessions today, which is taking care of your healthcare needs in Australia, both OSHC and OVHC. Now, before we just get started and I introduce our presenters, I'll just be quickly sharing my screen once again. There you go. Just to talk about a giveaway we're having on our final day. For those of you who participate actively in our sessions, 3 lucky winners have a chance to win $100. So please feel free to use the comment section in in your team's application or the chat box to leave your questions there, and then we will get to having these answered by our presenters. Now, we can get started. So with us, we have Mr. Swapnil Kamanka. He's a partnership manager at Bupa, who are undoubtedly a global leader in health insurance. So Swapnil, I think you can take the stage now and start with the presentation.
Thanks, Sherry. Good evening, everyone. So, health insurance in Australia, that's quite something that we've been listening, talking about, especially for the cohort that comes here as a student, and then and then migrate from student to OVC. So we are going to touch on few key points on what are the key differentiators between the Australian medical health system, what differentiates a health insurance company or Bupa as a provider, what we offer. Now, you might be able to see the screen, and you could see that we have something called a big cover, big country going on, which has been quite a good way to promote and understand what health insurance does. So first and foremost, it is good to understand that this insurance, whether you come here as a student or you're on a migration visa where you've changed from 485, this is only valid in Australia and Australian territories. You cannot use this overseas. When you go to any other country, this insurance will not work for you. We have a Now, coming to what is the difference between Australian medical or Medicare system, which is the commonly used jargon in Australia. Australian government or all the residents in Australia would basically have a green color card, which is called Medicare. And this Medicare card is something which acts more like a social security for all the Australian residents, permanent residents, and citizens of Australia. Whereas on the screen, if you would see private healthcare, that is the Bupa card, that would basically act as a similar healthcare provider for you, and we would cover most of the things. Now, Medicare basically is nothing but it's a government run public system, public hospital, all covered for everyone who is eligible for that. Even few people from different countries who come to Australia on temporary basis would get that Medicare card for few years. But most of students who come to Australia or migrants who come to Australia would completely rely on a health insurance company, and that's where the private medical insurance comes in place. Now, this basically would mean that anything that you need to go and see a doctor, you need pharmaceuticals, you need any tests that are to be done through a pathology, all would be covered, including your ambulance services, would be covered through the private health provider. That means you will not rely on Medicare at all. Now, there are a few key benefits that we do cover. We do cover unlimited emergency ambulance services. Now, the classification for unlimited emergency ambulance would be anything that is a life-threatening condition and is classified life-threatening by a paramedic or a doctor would be covered, all cost paid. Anything that is non-life threatening, where you can go to hospital or anyone can take you to hospital without a need of having a specialized vehicle, would not be covered under the health insurance. There would be few services covered for non-emergency, but all emergency services are unlimited. We do have a 24/7 This is only for students where they can have a helpline which they can speak to a nurse or a counselor, and that could be anything as well. We have 180 language available in that, where where you can as a student reach for accommodation, for any legal counseling, anything to do with your taxes, whatever you need. All this is available for students, and that's a 24/7. We have a QR code on the left side of the screen where you can get that QR code and you can download all this information as well. We do have something called Bupa friendly doctors, which offer direct billing, and there would be no out of pocket cost for students who are in Australia. Now, that would mean if you need to find out which doctor works with Bupa, we have something called Find a Provider on bupa.com.au, and you can check in just key in your postcode for the suburb you're staying in, and you can have access to all the providers that are currently working with Bupa in your local area. There is an 100% fees that we cover for all the doctor fees. Now, anything that we have MBS written, that means Medicare Benefit Schedule Fee. Now, this is a very commonly used jargon that can easily confuse most of the international students. Medicare Benefit Fee is nothing but it's basically a fee designed by Medicare and the Australian government for all the treatments in Australia. This would basically mean that if you go to a doctor, there is already a tariff that has been given to a doctor or for a particular X-ray or blood test, and we would pay in accordance to that fee. If the doctors charge you more, they will advise you well in advance that they are going to charge you more than the Medicare fee, and you are expecting an out-of-pocket cost. We have something called Blua, which is a very recent introduction to a Bupa offering. And this would be applicable not only for students, but also for people who are here on the visitor cover, mainly on the working visitor covers. We would cover Blua as a 24/7 telehealth doctor helpline, which could be through video or through telehealth. And this is 100% covered without any out-of-pocket expense. So if there is an after our call, or if you need to make see a doctor and you don't really need to go to a clinic, you can just use Blua, book your appointment, and the doctor, you would have a doctor appointment done online. Now, this is a virtual service. What is not covered with Bupa? We don't cover any procedures that are not recognized by Medicare or the Australian health system. They would not be covered. Any experimental treatment for any tests or any experiments that are currently running, and something happens if you have participated in that, we would not cover for that. Any respite care would not be covered. Procedures approved by medical advisory services will not be covered. Any assisted reproductive services will not be covered. There are some extra services that one can choose from. This is not a part of the package, but it's more of an optional service if someone really needs to go for dental, optical, physios, and any remedial massage sort of treatments. Or if you're active in sports, you need chiropractors or something like that, you can always buy an extra cover, which is available, and you have your own choice to pick and choose what you really want to be covered. But that would be an additional to the core cover that we were talking about, that covers about doctor visits, anything to do with hospital treatments, and over and above, if you need any of these extra services, they are available on bupa.com.au, or you can contact Aussizz Group and they will also be able to help you with that. Now, this is something that is very much a commonly asked question. What do you do when you visit to a hospital, and what are the options that we have? What do you do in case of an emergency? Will be an ambulance sent? Now, if you're really feeling unwell, this is where insurance is for, and this is where we encourage that you use the insurance. Most of the providers would have tie-ups with their own network hospitals. With Bupa, we have more than 90% of hospitals all over the country covered under Bupa's network, and more than 95% of GPs in metro cities are working with Bupa. So if you're really not feeling well and you need to go to hospital, you can go to any hospital of your choice. Don't worry about whether it's a Bupa network or a member first providers. Most of the cost would be covered, and any out of pocket cost would be told by the doctors to you. In case of as we spoke about BLUA, we will be touching more on that. But if you need to go and you need to see a doctor, you always can book an appointment through your local GP for any non-emergency, non-life-threatening treatments. But if you don't want to go to a doctor, BLUA is again something that we highly encourage all our customers to use. That is something which is cost friendly for you. You don't have to pay anything. And if there is something that doctor feels that you need to see a particular person, they would give you a referral and you can go and see a doctor. Earlier I was talking about find a provider or find a doctor. Here is the link in the in between the two slides where you can go and check for any provider near your area. You just need to key in your postcode or your suburb and we will give you the list of providers that we are working closely, which will not be costing you more than the Medicare fees. Now, the medicines and x-rays and blood reports, they can only be done through a doctor prescription. You cannot go out of your own choice and will to do a particular test. Any medications that we cover would only be prescribed and not over the counter. This is the QR code for BLUA. It's now confirmed that we also cover OVC and OSHC customers in this. You can scan the QR code again on the left side of the screen and you can have it in your phone handy. You can also have an appointment on demand if that doesn't suit your schedule and you can keep changing it. It's a 24/7 service. And all this, it can be done from wherever you are through your smartphone. You can do it from your laptop at your own comfort, wherever you want to do it. For anything that you need to find, we have something called My Bupa. My Bupa is an app designed for all Bupa members where you can find and see all your claim history. You can find all your personal details. You can update your personal details. If you have moved places, you can keep changing your address. You can keep updating your email address. Everything can be done on My Bupa. You can view claims. You can track your claims. You can submit your claims, and all the claims would be are processed from My Bupa would be paid in 3 to 5 business days. We have also introduced a digital membership card for all our members, and moving forward, everything would be digital so there would be no plastic cards coming through, which means you can have in your phone wallet, you can, whether it's an Android or an iPhone you're using, you can have your card in a digital form and you can go to a doctor, and most of the high caps which we have installed in the doctor clinics would accept the digital card and you can just make the payment through digital card. If you have any difficulties, we have around 65 stores all over Australia, and you can find the nearest Bupa store to any of the city you are located in Australia and Australian territory. And you can go to one of our stores and our store members would be more than happy to help you with anything to do with your claims or any other service related queries you might have. You can also search for hospitals and other healthcare providers near your area, which will be also available on My Bupa. We've already covered that you can make your claim on Bupa app, or you can go to My Bupa online and submit your claims. Once you have submitted your claims, we usually pay that to your dedicated bank account, whichever is registered with us, and you would get the payment done in 3 to 5 business days. This is the kind of digital card we were talking about, and this is what you can have on your smartphone. This is something which is very interesting that we have designed for our members, and we keep adding to this list. It's called Bupa Rewards, and this is something that we have exclusively offered to Bupa members, and this means that you get discounts on close to 45 partners for being a Bupa member, which means you can go to any of the listed providers on Bupa Rewards, and the longer you stay with Bupa, the more tiers you get and more points you earn to get an open exclusive benefit for all these providers and more that we keep adding. You would get 10 to 15% discount on most of the items. We also have few airlines that we offer discounts on if you wish to fly international or domestic. And when it comes to being connected with Bupa, you have My Bupa app, you have the in-person contact through our Bupa stores. Also, we have our contact centers, which are open Monday to Friday, 8 a.m. to 8 p.m. and Saturdays 9 to 1. And you can call anywhere from or outside Australia if you need to make any inquiries about your Bupa health fund related claims, whatever you want to make, you can do that. Now, based on what we have just seen, we also have OVC. Now, OVC is something that you would transit on moving from once you've completed your student visa and you have moved from student to 485 or any other working visa, you can always move to our visitor covers, and those visitor covers would basically cover you for something similar that you have been covered in your student cover. This means that there will be no waiting periods once you move from your student cover to a working visitor cover, and we will honor all the waiting periods you have been served with Bupa. This means that we will pay all the claims as they were. The only factor you need to be mindful is there might be certain services that may or may not be covered when you're moving, and that's where we have a selection of 3 different covers to choose from. One is our Essential Light, which is the most basic cover that covers doctor visits up to $300 only. Then we have Essential Visitor cover that covers unlimited doctor fees, and then we have mid 60 that covers both pregnancy, inpatient and outpatient, and also has a bunch of extras like dental, optical, and those services attached to it, which is by far the topmost cover we have. That was pretty much from me. I'm open for taking any questions if you have.
Thank you so much for that, Swapnil. I think we're just still waiting for a couple more questions to come in, but
Sure.
we actually did take the liberty of finding out on social media if we ever had any questions, which I think we as a business, we do get quite a lot of clients that we help with. We help with health insurance. One of the most common ones we've always seen is what are some of the points people should remember as an international student before they get OSHC?
One is you should look for what is covered in that service. Do you have any particular requirement that you need to be covered for when you're traveling overseas? So it could be a pre-existing condition or ongoing condition. Now, you have to be mindful that when you're taking a new insurance in Australia, there might be some waiting periods as well. In particular to pre-existing conditions, most health funds, including Bupa, there would be a 12-month waiting period when you're coming here as a student. So it is always recommended that if you're on a particular medication, you carry the stock of those medications for the first 12 months because that might not be covered through any health provider when you're traveling to Australia for the first time. Saying so, there are certain providers across the globe that we as Bupa recognize, and we do have tie-ups as well. So we strongly recommend this to students. If you're joining Bupa and you think that you are already insured in your home country, please voice it out and reach out to one of our consultants through contact center, store, or through you when like Aussizz is the best way if you're signing up a cover through you. Um, Tell them that we have a cover, and it's always a good idea to give us that certificate so we can see if we can transfer or take over some of those waiting periods, and that way you will have a option of not going through the 12-month lengthy waiting period and can get covered straight away for it.
Perfect. Thanks for that. I think a lot of people would like to hear it straight from you. It comes more personable. So 100%. That
Yeah.
is really, really nice. Yeah. Then we have a question on chat as well from Taha. He's asking, what is the price of the topmost cover, which also covers pregnancy?
Now, from the OSHC perspective, it depends on the tenor of cover you go for and you take. So it's more of a close-ended cover. From OVC, there would be a price. I can bring that up in a minute. So the question back to Taha actually is, are we looking at a single or a couple option there from the price perspective?
He hasn't mentioned it yet. We'll
Okay.
wait. Couple,
Couple?
couple. He's asked for
Okay.
couple.
Sorry, I just need to bring that up. It goes close to 460 is what I remember of memory, but we'll just confirm the exact price for that. So that the cover for pregnancy is, we cover pregnancy in most of the policies, Taha. It's the only thing is if you need inpatient and outpatient. So we have two options there. One would only cover pregnancy in hospital, and one would only cover pregnancy when you are both for doctor visits, pathology, and everything throughout the pregnancy. And that would be the mid-60 visitor cover, which is our top of the range. And that would basically cost you. So the non-outpatient cover for couples, for single, it is 29.21 per week. For a month, it is 126. So that is $499.69 a month, which is the top range. And if you go for the normal one, it would be close to $253. Yes, $499.
He's also asking, is it per year, for 99 per year, or
No. The
that's
visitor covers are monthly.
monthly?
So
Yeah.
So this is a visitor cover considering that you're on a work visa. Now, it also depends what visa you are on. So are you on student visa or you're on student visa?
Student.
Okay. For student visa, we've just changed the prices from today. So
That's a bit of a rough timing to remember.
yes.
Yeah.
All right. So now again, how long are you in Australia? It all depends on the student cover would depend how long your duration of stay would be. So do you know approximately what your visa would be for? Four years, you're for a couple.
PhD, yeah.
Okay. So if you're on a 4-year student visa, you're close to your total cost of insurance would be around 23,285.
Great, okay. Thank you for that. Think yeah, that should have answered that. If you have another follow-up question, please feel free to ask that. We also have one coming in from Paul. He thanked you for the wonderful presentation. Plus, he wanted to know what are the consequences if we have a visa condition to take OVHC, and if for some reason we don't take it.
That's something I think more of a migration question, but what I understand from that is if you're required by the department to take a visa, or if your visa outlines the condition 8501, you must hold a valid insurance all your stay. If you don't, I think you have a repercussion of your visa being declined or refused. I think that's what could happen. And that's where most of the working visitors or student should have a mandatory health cover when they are in Australia.
Yeah. Yeah, I thought so as well. I think, Paul, the best way would be to possibly reach out to Aussizz Group as well. I think
Yeah,
we would be a little bit, our agents, migration agents, will be a little bit more well equipped to have that answer. I'll leave that in the chat as well if you do want to reach out. Um, okay, so while we wait for another more questions, I actually had a question of mine, which I was very
sure.
curious about. So I've been with Bupa for 5 years. I've had them on 2 student visas, and I've had visitor health cover as well. So it was all about Blua. I think it's a more recent initiative, it's a
It
more
is.
recent program, right? Which I think what got me interested was it's great for the current medical environment, right? My generation loves sitting on the bed and having a doctor on their fingertips. It's great. It's crazy, right? How does that exactly work? So I'm on a student health cover now. I'm an international student. Kind of fearful of how the Australian medical system is because it's nothing like how it is in my home country, right? So if I had to use Blua in specific, how would that exactly
Sure.
work?
It's a great question actually, and you're right. Blua is not something that we had in earlier. It was a launch for last year, and it was a soft launch. We did not have a big launch on Blua, but slowly we wanted to make sure that we have a network of providers. Now, what Blua does is very similar. Most of us would have seen that telehealth is something that picked up in the pandemic, and it still continued for some time. But then we saw that students were paying a bit more because you go for telehealth and then doctor thinks that you need to go back again and see them in a clinic and things like that. That really makes it a bit of a difficult situation for students, that they have to double up for on their health insurance payments and things like that. What Blua does is exactly the same thing, but rather than having a telehealth, we have created a video link for that. So you can virtually have a chat to a doctor anywhere you are in Australia, and you can have a consultation. If the doctor feels a need, they will give you a referral to the nearest clinic you have. And the next flavor we have added is, to give more comfort, we have given 180 different languages. So you can basically talk to the doctor in your own home language or your mother tongue, and we have pretty much covered all the languages around the world. So there is no difficulty, and slowly we are now moving this from student to working visitors and then to non-working visitors. So if you have your parents visiting, you're at work or you're at the uni and they need to have a online appointment, they can just go on Blua. They can have the comfort of speaking to the doctor in their own language, and that's where I think it adds more of a benefit to all our customers.
That's nice. That's a great explanation, because I was actually kind of curious of how, the transition would be from, say, me having to do it on video call is fine, but
Mhm.
if there is a situation where now I have to see someone in person, because, the physical way is the best way to get it done, how would that
Correct.
transition be? I was a bit curious about that, but yeah, I heard, guess the referral part really works. But is there
Referral
a
part really
possibility?
works.
Yeah, but is there a possibility to also meet the same doctor who I video called with?
No,
Or how does that
uh,
work? They're not in this
they're
city or in this.
they're more like a setup where it's a 24 hours 24/7. So they are qualified doctors. They are authorized to practice in Australia, so they are not outside Australia or anything like that. So they would be in Australian doctors. I don't know, many of you might have heard the homesick doctor service, where you call
Yep.
the doctor and they come and visit you after hours, during the night and things like that. But this is something similar but more virtual. So this is 24/7. Doctors would be there. So these doctors are authorized to practice in Australia. They have gone through all the medical exams required to practice in Australia. So they're not someone who's sitting in any other country and giving you advice or a consultation. So they are pretty much in Australia. You cannot see them, unfortunately, because they are not working out of a clinic. They are working with Bupa, but they would refer you to either to your GP, or they would send you a script online. You can go to the nearest chemist and get the medicines. If they think that you should do any pathology test, they'll give you the pathology scripts as well.
Yeah, I think I'm just waiting for the day when pathology also becomes somehow online. So, life just becomes so much more easy. You don't have to move anywhere. Okay. Perfect. Okay. That was all I had actually. There was another question as well, which I think we're still waiting for another question, a little bit more from this people. But
Sure.
I had someone on Instagram ask this earlier, which I think raised again a very important point, which is, for international students who come here, again, different medical system. So what's the best way for them to get, situation appropriate advice based on when they're having a medical situation, obviously, for both students and visitors directly from Bupa. So because I handle a bit of the social media, I did tell
Sure.
them about the WhatsApp experience with Bupa, which because I use it quite often. Like I don't even want to talk to a physical person at this point anymore. As long as they're texting me, it's beautiful, right? But in case they're in a, like, obviously not a life-threatening medical situation, it's not an emergency. But if what was the best person they could talk to? What's the best way to reach out?
So in the slide, if you guys remember that we had a 24/7 advice line and helpline. It could be for anything. It could be basically you're not feeling well, you're feeling low, you want to speak to a person from, it could be anything related to your uh, mindfulness. I won't say mental issues, but I would say it would be more of a mindfulness. You are in a new country, you might feel a bit low, you might feel a bit sad, you might feel a bit homesick, and you don't know where to do, what to do. This is where the student 24/7 student helpline is something that we have created mainly for students. When you come, you have that kind of a support. Again, that has 180 different language support given, and it is not just for understanding or legal counseling or tax payments and those sort of things, or finding an accommodation. It's basically for everything. So it you can just ask for a service, and we'll be there for you to help you with whatever your journey in Australia is. As long as your medical treatment question was what can be done. See, you have your Bupa app, my Bupa app, which is the most handy thing. And you rightly said, we have a chat option, we have a WhatsApp option. You can, whatever comforts you, during that situation, we encourage you to go and do that. If it's a life-threatening situation and you don't know what to do, just dial 000. There would be paramedics at your door in 10-15 minutes, whatever the time is, wherever you are, and just tell them that you are a Bupa member, and the rest would be taken care of if it's a life-threatening situation. My whole emphasis to everyone who's online is, you have taken medical insurance, to please use it. Don't be hesitant what will be covered, what will not be covered. It's the main difference, and you rightly pointed out, Sherry, what is covered and what is not covered. It's a different country. One important thing everyone should know, that Australian health system is not risk rated, which means we will not exclude any particular condition, or we would not penalize you for using a particular service for the next year of your renewal, or we would not cover it afterwards. It's not like that. We are a community rated system, which means at any age, at any condition you have, all will be covered. Subject to, you might have waiting periods on that, but once you have covered the waiting periods, there is nothing that stops you from using a particular service. So if you have taken a treatment for that previously, and you have served your waiting periods, and you have that condition again, go for it. That's why you've paid the money for, that's why you want the insurance here, and that's what we will cover for. So that is one thing that I always encourage everyone, that if you don't know what to do, pick up the phone and just call the nearest health professional without giving it a thought that what will happen, who will pay for it. Most of the conditions are covered, except you want to go for a cosmetic surgery, which will not be covered unless it's medically necessary.
Perfect. Great. Thank you so much for touching on that, Swapnil. I think that provides a lot of insight for a lot of people who are just.
You're on mute, Jerry.
Sorry, I was just saying thank you for touching up on that. I think provides great insight for something which I think you mentioned about how people are not sure whether it's covered or not. So let's not use it. I did that for 2 years. So I know exactly how that feels. Like, is this covered? Is this checkup okay? Is that blood test fine? I want to check my vitamin levels. I'm not sure. That's great. So definitely I'll get those also passed on to our social media team to have that answered for that client who was asking that. I think we also have another question from Taha again.
Sure.
So his question quite lengthy, so I'll get through this. It's over a period of 4 years on my student visa. Can
Mhm.
I upgrade and downgrade my insurance plan level? So I think he means the first year would be elite one, and then the second year would be slightly lower. So it's basically like the first year would be like 499 a year,
No, no,
and
no.
then go
So
down to
we'll scrap
250 a
the
year.
499 1 year, because he's
Okay.
on a student visa. The 499 option which you've given is,
Yep.
I was assuming that they are on a working visitor sort of a cover, which
Okay.
covers that. But if they're on student, the cost is close to 23,000, which I've told, and that's not a per year cost. That's the whole 4 year term cost. So
Okay.
for the entire year. Now,
Okay.
about upgrade and downgrade in the cover, there is, for students, there is one level of cover. We don't have multi-layer covers,
Yep.
or we don't have
Yep.
a multiple levels there. For student, we cover everything at the same level, whether you're coming here for a year, 2 years, or 3 years. It's a close-ended product. You pay it once, and that's about it. So you don't have to pay month by month. When you transition from your visa, from student to working visitor, or to permanent residency, whatever you're eligible for, uh, again, that is when you would change to something which is more likewise what you've been covered for in your student cover, and that's where the 499 cover was given as an option.
Perfect. Thank you for that. I hope that answers your question, Tha. He says all right. He acknowledges it. So anything else as well, you can feel free to ask. He's clear about that. We'll ask for a few more questions as well if anyone does have a question. But also I think Swapnil, if you want to make a closing statement right now, also it'd be good, and then we can go back to the questions if there's anything that comes in as well.
No, sure. So, see, one thing which I would want to tell again is whether you're here on a student or if you're here on a visitor cover, just pick a call, go through my Bupa and go through the app, ask the question. Don't be hesitant to use your cover. The whole idea of you having this insurance is to look after your well-being, to make sure that you go through the right health and you have all the right options available for you. It's and if you don't want to use health insurance, I always ask them to use the life rewards. That is a good way to do. You can enjoy a movie at a discounted rate, join the gym at the discounted rate. So it's not only health insurance, there are a lot of other things that are packaged. One thing which I would want to touch on the closing statement is when you come here as a student or as a working visitor, you guys do change through a lot of things in your life. You will buy a car, you will have a house, you will increase your contents and things. As a Bupa member, we do offer discounts on those aspects of insurance products as well. So it's not only the visitor covers or the student covers, but as and when your life moves on, when you're settling in Australia, we do have other options to support you and look after you. There are a lot of tools available on bupa.com.au. There are a lot of tools available on my Bupa as your app. Just browse through it, use them for mindfulness, for anything that you need to know. Everything is available. And if there is anything, Sherry, yes, you can pass the questions to me.
Thank you for that, Swapnil. Think there are no more questions at the moment. Uh, what we could do is it okay to have your email shared here on chat as well if anyone has it, or would you want them to email it to us and then we reach out to you guys?
Uh, Either ways, I'm okay to share the
Yes.
email and yeah, I'll just
Okay,
put that
perfect.
in.
Yeah, if you just put
But
that on chat, yeah, because we also have a recording of this webinar that will go up somewhere, so people could also reach out to you if they
yeah,
need
sure.
to. Perfect. Okay.
All
Yeah,
right.
while Swapnil does that, perfect. We have that in there as well. I think we can move to closing now. I'd like to thank everyone for joining. I hope you got quite a truckload of information because I did. And I think my Bupa experience has escalated a little bit for sure. Now I know what to do, what not to. So thank you so much again, Swapnil, for joining us from everyone at Aussizz Group. We really appreciate you taking your time out and being here.
No, it was a pleasure. Thanks for having me, guys, and have a good weekend. Thank you.
Perfect. Thanks so much, Swapnil. Thank you, guys.
Thanks.
Catch you all soon.
Thanks. Yeah. Bye.